Hello and welcome to Eye Insider Ophthalmology Simplified. In today's class, we shall discuss regarding the principles of strabismus surgery. So there are 4 principles of strabismus surgery. So the first is to reduce the angle of deviation or strabismus, that is squint, to reduce or eliminate diplopia or double vision, to reduce or eliminate anomalous head posture which is associated with the squint, and to increase the binocular single vision. So the surgical procedures for strabismus include weakening procedures, strengthening procedures, and transposition. We shall discuss each of it in detail in this class. Coming to the weakening procedures, we have recession. So what is recession? It weakens the muscle action, which is by disinserting and moving it away from the limbus. So the insertion is moved away from the limbus. So this in turn reduces the arc of contact and reduces the power of muscles. We have newer version called Hangback recession. So in this, it reduces the complication of scleral perforation. We just cut a bit of the insertion and tie it to the insertion itself. We also have adjustable sutures for recession. So this helps to reduce or increase the amount of recession done depending upon the residual squint or residual and squint left. So this is the recession. So the insertion is moved back, and this is the hangback recession and hangback recession with adjustable sutures. So here we tie a knot. That knot can be tightened or loosened depending upon the amount of squint to be corrected. Then is myectomy. So myectomy is disinserting the muscle and not attaching it to the sclera. So it is performed for inferior oblique weakening. So if you are not subscribed, please do subscribe to my channel. Myotomy is partial division of the muscle fibers or removing a portion of the tendon. So these procedures are not commonly used. Then we have retroequatorial myopexy. It is also called fadens procedure. So in this, the muzzle is fixed to the sclera posterior to equator. So this reduces the lever arm, so which in turn has no effect in primary gaze, whereas it reduces the movement of the muzzle in the direction of the action of muscle. So in the primary gaze there is no effect, whereas when the muscle is acting, it reduces. So this is the diagram showing the retroequatorial myopexy. So A and B is the lever arm. So what happens in the right side image, you can see it is tied posteriorly to the sclera. So when the muscle is acting in its direction, what is happening? The lever arm, that is, instead of AB, it has become CB. Okay. So there is a reduced rotational force. Now coming to the strengthening procedures. In the strengthening procedures, we have resection. So in resection, what is done? The muscle is shortened and reattached to the original insertion site. So plication or tucking is that the muscle is shortened but without detaching it or without cutting it. So the blood supply is remained intact, and this is done by folding the muscle upon itself and suturing it. Coming to transposition, it is when a muscle has no power, the neighboring muscles are recruited to perform its action. We have various types of transpositions which are commonly used for the nerve palsies. We can perform either full tendon transposition, partial tendon transposition. Okay, so the full tendon is not preferred because the blood supply is lost and can lead to other side effects. Okay, so whole muscle transplantation is the procedure that which involves full tendon transplantation. So these are performed commonly in case of lateral rectus palsy, that is 6 nerve palsy. We also have Hummelsheim procedure. So in this, a part of the superior rectus and inferior rectus is attached to the lateral rectus. So these are split longitudinally and attached to lateral rectus. In the Jensons procedure, both superior rectus, inferior rectus as well as the lateral rectus is also split longitudinally and attached to each other. So these are some of the procedures which are used in the transposition. So if you like my channel, please subscribe to the channel because it means a lot for me. The complications of these include lost muscle, slipped muscle and globe perforation. Most common severe complication is globe perforation. Lost muscle means that there is reduction of action of the muscle which is immediately post-op, and it is commonly due to slipped knots. Slipped muscle is occurring late, that is weeks or months after the procedure, and is due to scar or pseudotendon. Globe perforation is 0.1 to 1% and is more in children and myopes. Thanks for watching. Please subscribe to my channel. Bye bye.